Welcome again to our first qualitative training webinar for the EMUs and CAMEL projects. I want to start by giving you an overview of the qualitative training. So part of the qualitative training is delivered via self-paced online learning in collaboration with the GSU Education Center. I've sent out the link before. Do let me know if you've got any problems accessing this. The link is also included in the slides, which we will share after this training. And then there's this live webinar today, live webinar 1, which will focus on how to conduct interviews and focus groups. And there will be a second live webinar later on. The date will be announced in April. And that will focus on data management, data analysis, and hopefully there will be some time to have an interactive exercise on how to do qualitative data analysis. But today we are doing live webinar 1, and we will focus on how to conduct interviews and focus groups. So I want to give you an overview. Our agenda today, we will cover quite a lot. Hopefully we will get through it all and you will not be overwhelmed, but having a good idea of what it is we are doing with the qualitative work. So I will talk about the value of qualitative work in surgical research really briefly. And then I'll give you an overview of the EMUs and CAMEL projects and the study-specific requirements. And in particular, looking at it from the qualitative side, what the qualitative work will be. There will be time for questions and discussion. We will have a short break, hopefully. And then we will go into the logistics of carrying out the qualitative interviews and focus groups. I will talk you through some skills, tips and tricks, translation of study documents, how to record and upload the data, dictaphone training, and we will also have a look at the timetable so that we know what we are working towards. So first, and you may have already seen some of these faces, but I think it's always good to put names and faces together. Hopefully you remember everybody. Of course, you might know me. My name is Teresa Ikegwano. I am a research fellow at the University of Edinburgh. And you can see pictures of my colleagues here. I don't think we've got so much time to kind of let everybody say it themselves, but you can see who's been involved in the qualitative research training, collaborators and contributors. Yeah, so I just wanted to include that. And you will get copies of these slides as well after the training. The aim of the webinar today is really a train the trainer model. So what we're trying to achieve is to build capacity and to empower staff who are doing the qualitative work in the hubs to gain the skills needed to do the qualitative work for the EMUs and CAMEL projects, but potentially also for beyond, to carry that skill forward for further work that you might be doing. So there will be continued support via qualitative training drop-in sessions. And if you've got any questions, feel free to email me anytime if you want to arrange a meeting or, if there's anything you need any help with. So I want to cover the value of qualitative work. And I'm sure that you all know that qualitative work is very valuable, which is why you're here wanting to learn more about it. So it allows us to explore the real world context, to get an in-depth, deep understanding of kind of what's going on the ground. And it's particularly important for these projects because it can help us identify barriers and facilitators to implementation, for example, that we might not have found if we are using only a quantitative approach. So it's really good alongside the other work we are doing to get this real world contextual insight. And let's look a bit closer. I give you an overview, a summary of the EMUs and CAMEL projects. So you probably all have heard EMUs and CAMELs already many times, and maybe many of you know what it stands for, but I thought I'd briefly go over it. So EMUs means enhanced monitoring using sensors after surgery, and CAMEL creating new models of laparoscopic surgery skills acquisition and assessment. So I will talk about the EMUs project first. The main objective for the EMUs project is to determine if data from wearable sensors can be used for the early detection of post-operative deterioration, while also being acceptable to patients and healthcare staff. And with the qualitative component, our main methods of data collections are semi-structured interviews, focus groups, questionnaires, and non-participant observations of use, though today we are focusing on the semi-structured interviews and focus groups. And the focus of the qualitative work is on the technology used by healthcare professionals. And we are interested in stakeholders' attitudes towards the technology. You will see in a moment with the emus, there will also be some patients involved. So we want to know, what their thoughts are about using this technology to identify what could be barriers to using this in the future. So we are looking for feedback on the usability and, like I said, barriers and facilitators to technology use in a real-world setting. And many of you probably know our settings in emus Global, and it's the same for CAMEL as well. I will only go through it once, and then I will just let you read it yourselves. So we've got hubs in Ghana, Nigeria, India, Mexico, Guatemala, Benin, and Rwanda. So with the emus project, we are using Cybel's ANI-1 dual sensors monitoring system. So some of you may have seen the pictures already. I've included them here so we can have a look. So ANI-1 has got two sensors. One is a chest sensor and one is a limb sensor that gets attached to the finger. And they get paired to a tablet called ANI-View that kind of live streams or that you can see patients' vitals in real time on that tablet. So this is some more pictures in case you haven't seen it yet. So this will be used for the EMU project. And the EMU project has 3 stages, and I will show you a table of it as well in a minute. So stage 1 is taking place in a non-clinical environment and is looking at the usability of these devices with clinicians, nurses, healthcare workers. And then stage 2 moves into the clinical environment. And we're looking at a baseline post-operative monitoring practice assessment and further device usability testing. And then stage 3 is a shadow mode cohort study with the collection of time-stamped sensor and clinical event data. I've highlighted stage 1 and stage 2 because that's what we are focusing on. And you will see in this table here that stage 3 for emus doesn't actually have a qualitative arm. So we are really focusing on stage 1 and stage 2. So for stage 1, the aim is to evaluate healthcare professionals' ability to use the technology in their local health system and determine any initial concerns they may have with the system. So very important, for the next stage and for carrying this forward. And for that, we are looking to include 5 healthcare professionals per site, ideally in a focus group, 1 or 2 focus groups, depending on, if all 5 of them can make the same date. You can also set it up as 2. Or if it's preferred, you could do 5 interviews as well. If it's not possible, healthcare professionals are very busy. So if it's not possible to get everybody at the same time, there's some flexibility as to setting up 2 focus groups or doing it individually. And then stage 2, live testing in the clinical environment. There will be 20 patient interviews. And again, 1 focus group of 5 interviews with the 5 healthcare professionals to have a look at changes that may have happened. So this is kind of similar information that we have just gone through. Usability focus group in stage 1 and stage 2, the live testing. So the patient interviews will happen around about the time of discharge, and we are aiming to include the 20 patients to see how users operate or interact with the system and to investigate potential changes to practices. So that was a quick run through of emus. Hopefully that made sense. I will go through CAMEL, and then after that we will have some time for specific questions about the projects. So this is some pictures of the laparoscopic simulation labs, which have been established across all the hubs. You can see some pictures here from the various countries. Here is an overview of the settings again, as promised, so that we don't forget. We've got an overview of the stages for QUAL here as well. So QUAL is in 3 stages, and year 1, which is the year we are in just now, is focusing on stage 1 baseline mapping and stage 2 evaluation of the standard technology or the EUSIM laparoscopic box simulators. So for stage 1, our aim is to do 20 interviews and 1 focus group, and that's baseline mapping, which looks to identify the range of needs, and that will inform the development and optimization of the intervention. And then stage 2, we are doing a qualitative process evaluation of the implementation, and we're aiming to do 10 interviews per site, 1 focus group, 4 non-participant observations, and 20 questionnaires. And there's a stage 3 as well, which I'm not talking about that much because we're focusing on this year in stage 1 and 2, but stage 3 will be a qualitative process evaluation of implementations, and you can see what is involved here as well. So with the baseline mapping, the objective is, so that's QUAL stage 1. The objective is to assess the current state of laparoscopic skills training and acceptability, attitudes, experiences of current framework, practices, and technology. So really the focus is on what's going on at the moment. So we are looking to understand stakeholder needs, what are current practices. The participants for QUAL stage 1 will be medical students, junior and senior trainees, consultant surgeons, educational teams, managers. So some of you may have taken part in a stakeholder mapping we did. So that was aiming to identify the various stakeholders. But if you didn't, don't worry. You can be updated on what the findings are on that as well. Just get in touch. And the aim, like I said, with this is to do 20 interviews and 1 focus group. And QUAL stage 2, which is an evaluation of the standard technology. The aim is to assess learning curves and the use of standard box trainers. And the participants are the same kind of group of people as in stage 1. And then here we are aiming to do 10 interviews, 1 focus group, and 4 observations. And the QUAL stage 3 evaluation of novel technologies, I'm not going to focus on it, like I said. I will focus on the immediate priorities for this year. So with the qualitative work of QUAL, we are aiming to understand stakeholder needs and to help to develop innovations that are most likely to be adopted and bring benefits to healthcare settings and patients. So I've already gone over the participants and the methods, semi-structured interviews and focus group. And you can see a photo here of our colleague Wale using the box trainer in Lagos in Nigeria. There are study-specific documents. So in most hubs, the documents are currently being reviewed by local ethics committee. And I know some hubs already have ethics in place, which is brilliant news. The best point of contact is your hub director or hub manager, who can let you know where things are at. And, I'm sure they will let you know once ethical approvals have been granted. So also check with your local team where your documents are saved, so that the relevant people can access them. And for interview and topic guides, and we will come back to that later on, there are key questions which we all need to keep, and then there's some flexibility when it comes to follow-up questions and probing, so you can adapt it to your local context.